A new report just released today reveals how prepared California is compared to others when it comes to emergency public health disasters. And according to the study, fewer than half of states are considered highly prepared for a public health emergency. We're joined live now by Dr. Nadine Gracia, President and CEO of Trust for America's Health. Thank you so much for being with us. We really appreciate it. And I think, after living through COVID and we're a state prone to earthquakes and other disasters, it's really interesting some of the data that you found out. So can you tell us what indicators you looked for?
Yes, and thank you for the opportunity. Our report assesses our national level of preparedness and also the states in looking at a set of 10 indicators that are closely associated to preparedness. Factors like the ability to expand your healthcare capacity in times of an emergency or public health laboratory capacity to do increased testing. We look at the level of funding at the state level for public health, as well as factors like water security and the quality of hospitals and their safety and patient-grade safety ratings.
I think this is such important work because so many of us had so many questions during the pandemic. What is the government doing? What aren't they doing? What's our state doing versus the federal level? How did California end up shaken out in what you found?
So in this year's report, states again are grouped into 3 performance categories: high, middle, and low performance. California was scored in the middle performance category. And something that we point out, and we look at strengths for the state. One, the state has both public health and emergency management accreditation, and that advances the quality of the services and accountability and assessing the strengths and weaknesses of the state. The state also has plans in place to be able to surge its testing capacity through the public health laboratories in times of an emergency. What we know are some areas of opportunity, and even for the states that are in the high performance categories, they also have the opportunity to continue to improve in their performance. One factor is having a plan in place with regards to healthcare surge, as far as having workforce and personnel that are able to meet the needs in times of crisis, as well as looking at the level of state public health funding. We've seen in the past 2 years that overall that funding has been reduced in the state. There are other factors like ensuring employees are using paid time off and being able then to control infectious disease outbreaks. For example, if someone is sick or needs to stay home and take care of someone who's sick, as well as increasing the rates of flu vaccination, which we know is important, vaccinations as a key step to preventing infectious disease outbreaks.
Well, I'm glad you broke that down for us. It's interesting to see California in the middle tier there, because it felt that we were doing pretty well. But as you said, even those functioning at the highest rates have some work to do. So we appreciate you breaking that down for us and also showing us what states can do to be better prepared wherever they are on the list. So thank you for being with us. We appreciate it.
Thank you for the opportunity.